Hello, I'm Dr. Sandeep Gandhi, a specialist in infectious diseases. I get consultations and I see patients with a variety of infectious diseases: sepsis, pneumonia, urinary tract infections, tick-related infections, and lots of travel diseases. For a patient who comes into our tick clinic, they certainly have concerns about if they have Lyme disease or any other tick-related infections. We ask them their history. We ask them what their clinical signs and symptoms were, whether they have gotten bitten by a tick, whether they have a significant travel history, whether they have been exposed to animals or pets, and what they have done for their illness so far. The signs and symptoms of Lyme disease include initially a cold flu-like illness. Some people, about 60%, get a bullseye rash. However, the bullseye rash, even though it's classic, we do see a variety of skin lesions as the initial manifestation of Lyme disease. Some of the symptoms of Lyme disease can mimic other diseases. And because Lyme initial manifestation is cold flu-like symptoms, certainly viral diseases can be as such. Some of the atypical presentation of Lyme disease, and fortunately they're rare. You can have a pain in one nerve distribution. You can have fainting spells if there's a heart block involved, and that usually initially is seen by a cardiologist. Some of the complications of Lyme disease when not diagnosed or treated early include neurological Lyme, which can be encephalitis. In addition, you can have arthritis, which is an inflammation of the joint. And remember that some people have a genetic predisposition to these things. In addition, there can be heart involvement known as carditis. A co-infection means that there are other diseases that the patient has when exposed to a tick bite.